Alrighty. It is April 16th, 2020. I'm here with Dr. Lazzopina. Dr. Lazzopina, thank you very much for letting me interview today. I guess to start off, sir, what kind of medicine do you practice, sir?
I'm a family medicine physician.
Okay, nice. And I guess do you have your own clinic that you practice out of, or do you practice out of somebody like at a joint clinic?
Right. So I started my solo direct primary care clinic in July of 2018. So I've been doing this for almost 2 years.
Okay, nice. Cool. And I guess since we are in a pandemic, I guess how has this pandemic affected your work essentially?
Hmm. It's been kind of interesting. It hasn't been hugely different, except I'm doing a bit more phone calls and video chats. But the way my practice is set up, I did a fair amount of that already, and it made it pretty easy for people to take that up. So if anything, it just seems like some of the older crowd that was used to coming to see me for everything and realize that they can call me a lot more and they don't need to necessarily come in.
Okay.
Um, so yeah, my day to day life is pretty much the same. I just talk to a lot more people like this
Okay.
via chat instead of in person.
Okay. Nice. And I guess one of my questions that I ask people, like, if I guess, do you feel safe while you do your job?
Yeah, it was kind of uncertain and unclear, like what was going on at first with the coronavirus. So I was somewhat concerned, but as it's become pretty apparent that really just people over the age of 60 are the ones at most risk, and younger people pretty universally do really well. I mean, there's very rare cases where somebody gets very sick, and a very few where they die. But for the most part, people under the age of 60 are doing great. And so even if I were to become infected with coronavirus, and even if I didn't know and took it home to my kids, they're all going to be fine. And so I feel okay about it. The only thing that concerns me more is like if I were to have an older person come into the office, I don't want to, be infecting other people. And so that's the main thing. That's the reason we take precautions.
Okay. And what are some of the precautions that you're taking at your clinic?
So for every patient encounter, I wear a regular surgical face mask, and when I examine people, I'm wearing gloves, which I don't usually do. Um, and then whenever we do an actual coronavirus swab in the nose, I'll wear an N95 mask just in case we make them sneeze and they sneeze right in your face. And I have glasses on, but you also want to wear some sort of eye protection as well when you're doing that kind of test. And then I'll put on. You can't get the gowns that people wear in the hospital, the disposable gowns, the yellow ones. So I've just been wearing my old white coats, and I just wash them after I do a swab.
Okay. Now, I guess for since you mentioned that you do like the testing for coronavirus, like what is the process of the testing? Like, what do you do exactly?
So there's two ways to do it. You can call the state with somebody who has symptoms, and typically they need to have been in contact with somebody who had the coronavirus, and then you can arrange for the state to do it at one of the drive-to testing centers, or the commercial laboratory that I work with. It has a capability to do the test as well, and so and that's a lot easier because you don't have to meet certain criteria. So I just counsel my patients, you're at low risk or high risk, and I think we should do the test for this reason. And then they come by the office, they park on the side of the building, and I just go out to their car and we do the swab. And all it is a little, it looks like a really long Q-tip, and we just insert it into the nose all the way to the back of the throat and spin it around and take it out, and that's it. It's kind of uncomfortable, but it's not terrible. And then we send that off to the lab, and it takes 2 to 3 days for the result to come back. It's
Okay.
fairly quick.
Nice. And I guess if when you have had had to do the testing and you hear back, have you had any cases of having a patient be in contact with the coronavirus?
Sorry, say it again, Miguel.
I said, I guess since you are doing the testing, like, have you had any cases where like you've had a patient that did come in contact with coronavirus and did have it?
The only person I've had one person who's lives in a nursing home, and they were positive. I didn't do the test on her. That was done at the nursing home because she had a known contact that was infected, and so all the people in the nursing home who were in contact with that person were tested. Other than that, all the people that I've tested here at the office have been negative.
Okay.
Um,
Nice. Hold on, let me get my other questions here. I guess I guess essentially, like, this is like a pretty easy question. Like, but would you consider your profession to be essential in this time?
yeah, I think so. I mean, I haven't actually been dealing a whole lot with coronavirus issues. It's more just the regular problems that people get, whether that's urinary tract infections or a regular cough and cold or allergy problems or gallbladder, stomach pains, all those kind of things that people get. We're still having to deal with those things. Um, they don't go away even when we're sheltering in place.
Nice. I know in the past that you and Dr. Jarrett, you guys did, like missionary work. You guys would go to Mexico and help out over there, medically wise. Do you continue to still do that?
Um, yeah, we're still so we do a free mission clinic with Culture of Life each week on Wednesdays, and so we're continuing to do that. That's changed some. Before we had like 15 or 20 people in a waiting area, like all clustered together, like sitting side by side, and so that's not acceptable right now. So what we're doing now is having people call in, and we talk to a lot of them over the phone. Um, and so, yeah, we're still operating. We just haven't been able to. We're not doing things the way we were before, but still helping people out. We also started a free telemedicine um, service valley-wide as well.
Oh, nice.
A whole bunch of doctors besides me, and nurse practitioners and physician assistants, and several other volunteers are kind of coordinating it all. And so anybody across the valley can register, and then we call them and try to help them out with medical problems they're having.
Oh, okay. Nice. Now, I guess what is like since it's all over the phone, do you still have to come in contact, or I should say, since you said the majority of it's like over the phone, do you still have to kind of come in contact with some of the patients that are like low income, or if you have to go over into Mexico?
Um, yeah, I mean, for anybody who we think needs an in-person visit, whether they need like some sort of lab testing or they need their lungs listened to, then we'll either refer them to the doctor they had seen before, or if they don't have a doctor, then we'll try to connect them with Culture of Life Ministries. We're still operating and still able to see people in person, and so that's what we do for people who need, to be seen in person. But a lot of simple things we can take care of over the phone. So for the most part, we just take care of it over the phone and
Okay.
prescribe medicines if they need it, and
Okay.
keep moving.
Nice. Awesome. I guess moving into your family and like your personal life. What are some of the precautions that you and your family take at home?
Um, so the kids just hang out around the house and outside in the, or in the yard. So we're not really taking them anywhere. Um, and then other than that, I mean, when we go out, we wear a mask because we have to. Um, and that's about it. We always try to wash our hands and have the kids wash their hands. And but like I was telling you, even if they were to get sick, they're all going to be fine. Like kids between the age of 1 and 9, they just have mild cold symptoms and get over it pretty fast.
Oh, okay.
So I'm not particularly worried about them getting sick. It's more just keeping them from getting other people sick. So the other thing we're doing, we're not like visiting our grandparents or anything like that. We just
Mhm.
are keeping separate so that we don't get anybody else sick.
Okay, nice. I guess let me see. Trying to see how I word it. Um, oh, okay. I guess going back to like your practice, sir. Like since there is a shortage of like gloves and face masks, have you experienced that at your clinic, like a shortage of masks and gloves?
We couldn't get any N95 masks at first, and then I managed to scrounge up one from Culture of Life, and then one of our farm families had a bunch of them that they donated to us, and another one of a border patrol agent had several, and they were able to share with us. So yeah, I know we have plenty. And we've had plenty of gloves. They're easy to get. It's mainly the gowns are the only thing that I haven't been able to get, but
Okay.
it's not a big deal. We're not doing enough
Okay.
coronavirus where it's really a problem. You just wear a jacket and white coat and wash it.
Okay.
So doing
Awesome.
great.
Okay. Nice. Now, I guess if you do I guess when you do have to go out, like just for regular shopping, like just getting essential items, like do you like try to educate some of the people around you, like, hey, like try to keep your distance. Like I know, like you want to kiss, be with your family right now, but like do you like kind of educate other people about the coronavirus and keeping 6 feet apart?
hmm Yeah, my wife does all the shopping, and so the only time I've been to the store in the last month was when we ordered some stuff from Target, and we warned them we were coming, and we pulled up and they walked out and put the stuff in our van and we drove away. It was pretty amazing, actually. I'm never going in a store again. That was
Uh,
beautiful. Yeah, so I'm hopeful that that's one of the good things that comes out of the coronavirus, that I will never ever set foot in Walmart in my life. Just do things that way. So yeah, I don't. Yeah, I haven't done any like public education stuff aside from on Facebook. We're doing Facebook Live events and kind of sharing about what's going on with coronavirus and ways to prevent it and that kind of stuff.
okay, awesome. I guess in your community, do you feel supported by your community? Like, you're out there, helping them out and stuff. Do you feel like they're that support essentially out there for you?
Oh yeah, absolutely. I've been really impressed. Like people will just call me and text me during the week to be like, "Hey, are you doing all right? Is there anything you need? Your family doing okay?" And then yeah, like I was telling you, that people have been super generous with masks that they have sharing with us, and so yeah, I feel like everybody's kind of even pulling together even more than usual, and yeah, it's pretty cool. I really appreciate that.
Awesome. Awesome. Now, I guess one more question on like I guess the family. Like I know you have children.
Mm-hmm.
Um, like how I guess how have they been taking it, not being able to go to school, not being able to see family or friends?
Yeah, they're doing good. I have four boys, and so they're used to playing with each other a lot to begin with. So that it's good for them, and that they have that kind of their own little social network, even when they can't be around other kids. So being stuck at home all day with mom, I know is getting on mom's nerves a little bit. Just doing all the homeschooling and all the other stuff that needs to happen around the house besides. But the kids they're doing pretty great and getting to play outside. And in some ways, it's been cool to have a little more family time. Easter was really interesting. You couldn't worship with the church family like you usually do, but we got to have our own family worship times together, which was really fun and powerful in its own way.
Okay.
Uh, so it's a little weird, but they're still thriving, which is great.
Awesome. Cool. And I guess my my last question, it's more of an I guess an opinionated question, like what your opinion on this. Since you do come from like a medical background, like what do you think is the or what do you think about like the essentially like the US response time and Texas response time to the pandemic crisis?
Um, yeah, it's interesting. It's one of those things like you're kind of damned if you do and damned if you don't. Like, um, if you shut things down early and it turns out to be nothing and everything gets ruined, like, economically, you're going to be blamed as a politician. And if you don't shut things down and people get really sick and it's terrible for the hospitals, like in Italy, you're also going to be blamed. I don't know. I can't tell you. I feel like I would have done any better than anybody else in office, even with a medical background, because this is so unprecedented. There are a few like virologists who this is their specialty, and they recognize pretty early that this could be really bad. So in January, you're starting to hear some of that towards the end of January, and then more in February that they're like, hey, this could be really bad, and but nobody really knew who was going to get sick and how sick. And now that it's become clearer, I think what we're doing, it's really kind of heroic for all of us to pull together to protect the most vulnerable in our society. It's not something apart from like our Christian background and heritage that would have happened in other times in other places. I don't think, where we recognize that the oldest and most vulnerable could really suffer, and the rest of us probably going to be fine, but we're still trying to keep everybody from getting sick so we don't make them suffer. So I think what we're doing is the right thing to do, and it's obviously happened a little too late in New York, but the rest of the country, for the most part, seems to be doing really, really well, as well as you could expect with something like this. So either way, we trust the Lord and know that He's going to take care of us, and He'll make it right in the end.
Okay. Awesome. Cool. Well, thank you very much, Dr. Lazzopina, for letting me record you and interviewing, sir. I greatly appreciate it, sir.
Yeah, thanks for letting me talk to you. It was fun. It's good to see you again.
All right. You too, sir. Thank you.
All right, tell the family I said hello.
All right. Will do, sir. Thank you very much.
All right, bye-bye.
Bye-bye.